Hello, this is Dr. Robert Abell for PureMedicine.com. Today, I'd like to talk to you about what is called physiology. Now, it sounds like a big word, but basically what it means is how the human body works. In other words, why does the body do what it does? So, physiology is something that's very important. It's one of the major things that you learn in the first year of medical school because that's how important it is in the body. So you really have to understand physiology, which is the way the body works, and you have to understand anatomy, which is the structure of the body. So those two things are really important when you're first learning medicine, because if you don't get that down, then it's really hard to implement all the other things. So physiology to me was always something I was really interested in. My undergraduate was in exercise physiology, which is really the way the body works and is stressed under exercise. So with medicine, it's more, how does the body work in general? Why do we get sick? Why do we not get better? Well, a lot of that is based on our individual physiology or individual way that our body works. As you know, everybody's different. Everybody has a different capacity to do certain things and to be able to deal with certain things. For example, someone could go out and drink 12 cans of beer and be perfectly fine the next day, or someone else could drink half a can of beer and they've got a headache the next morning. That's just our individual variances, which is based on our physiology or the way our body works. A lot of that has to do with the liver and the way the liver can metabolize the alcohol. So everyone has different physiology, and one of the things that we try to do, and what we do in our medicine, is to try to create protocols and to create things that help people get better according to their own physiology, not a textbook diagnosis from a book, but what is going on with them. How are they working? What is wrong with this personal individual? In other words, I could have 100 patients with arthritis, and every single one of my treatments will be different. Because just because you have arthritis doesn't mean you're exactly the same as someone else who has arthritis or migraines or whatever the condition may be. You have to look at the causation of why they have this condition, and then you have to get the body to start working the way it's supposed to. And that's really what physiology is. Physiology is your body doing what it's supposed to be doing, or is it not? Diabetes is a perfect example of that. Diabetes is when your body either doesn't produce enough insulin, or your cells they don't work with insulin correctly. So that is physiology. That's your sugar physiology, basically, your blood physiology, your hormone physiology. So every single person is different. And so what one of my teachers, Dr. Gerard Gagnon, he would always say physiology over pathology. And what he meant by that was physiology is the most important thing to consider when someone is sick. Pathology is basically the end state or the result of having a bad physiological system. So in other words, if you develop arthritis, that change in the bone structure is due to something wrong with the physiology. So what we do is we pull the physiology back, correct it, take care of the reason why you developed arthritis in the first place, and then the body will heal. And one thing I stress over and over and over with my patients is the body has the capability to heal no matter what. Yes, there are conditions and people who have gone so far down over the waterfall that their body isn't going to return to a normal state because they're 90 years old and have a severe illness. I get that. I'm talking about in normal situations, the human body has this incredible capacity to regenerate itself and to heal. And that's really what we're looking for, is how do we return the normal physiology, and that way people actually get better. Even a pathology can reverse itself when you start normalizing the physiological systems in the body. So Remember that term, physiology over pathology. Correct the physiology, pathology goes away. And it does take time. I'm not saying this is going to happen overnight. This takes months, years in some patients, depending on how bad that chronic condition has become. So anyway, just a basic education on physiology and why it's so important and why we stress it so much. All right, have a great day. Take care.